Part 3, Allergic Rhinitis. This lesson is 8 minutes. Dr. Krako will discuss allergic rhinitis, often called hay fever, in which pollens, molds, dust mites, and animal dander trigger nasal congestion, sneezing, itching, and runny nose.
All right, our third module is the most common cause of the congestion that occurs in patients who are having the blockage in the nose, and that's allergic rhinitis. And allergic rhinitis refers to things like hay fever, grasses, often seasonal, almost always in the spring and the fall. But you can certainly have it all year long. And in fact, another treatment pearl is that in general, if you've got any type of rhinitis condition and you notice it a lot in the spring or you notice it a lot in the fall, more than likely you also have it all the other months. It's just less noticeable because it's less dramatic. And this goes back to our major point again, that you don't pay attention to that small amount of congestion. Why? Well, because it was so much worse in the spring and the fall. And so you're thinking, that's what I need to pay attention to. Allergic rhinitis is something that you again start out with these simple steps. And they will often have very important consequences of good outcomes. But they may not produce the results you want in the spring and the fall in particular. And the question would be, do you do more of these? In some cases you might. Or do you add some other elements, such as an over-the-counter spray called Nasal Crom, and then for what they call the big guns, do we go to nasal steroids? And this is how we start with treatment in terms of our model at a sleep center, because as a patient, you're saying, I have a problem with insomnia or a problem with sleep breathing disorders, and we're helping you appreciate that breathing through your nose can help insomnia or sleep breathing problems. So we want to be as aggressive as possible. We'll train you on these elements, and then we'll make decisions about nasal steroids. As soon as you say the word steroids, people always question, well, wait a second, why would I want to take steroids when I can just take an over-the-counter antihistamine? And here you have to understand that the steroids do not get absorbed systemically, to the best of our knowledge in medical science. There are people in alternative medicine fields who will make claims that these do cause problems. I have heard those claims. I know colleagues that actually think that. I've never read any evidence that proves that. The only people who can have problems with the nasal steroids tend to be someone who would be immunocompromised. There's a chance for it to be dangerous because they could be at risk for a fungal infection if they had too much of the nasal steroid. Another very obvious side effect is nosebleeds. And that's why we're taught that when you apply the nasal steroids in particular, and it could be true for some of the other sprays as well, you do not want to point the spray inward along the septum because that's where there are more blood vessels. And if the blood vessels become slightly weakened in that area because of the steroid, which can happen, that can make you more susceptible to the nosebleed. So you always point it outward. And by doing so, most people report a reduction in nosebleeds or a complete elimination. Are there some people who will always have nosebleeds? Yes, some people have other anatomical issues that come up that have to be addressed. But these are outstanding treatments, the nasal steroids in particular. Some people, I've gone through this progression of the saline, sinus rinses, then nasal crom, then nasal steroids. And you will find that that is sufficient. You might find that you stop at nasal crom and you're done. That's all you needed. You didn't have to go any further. But as the condition becomes more serious, for example, in the spring and fall, or as the condition is more serious because you're trying to use, for example, CPAP therapy, because you have sleep apnea and you really have to get a good response, you have to have what we call a zero tolerance policy when it comes to nasal congestion. And so we have many, many patients that we prescribe all of these things. Nasal crom, nasal steroids, saline, sinus rinses, do the neti pot washes. And again, same kind of results for the people who only have the allergic rhinitis. Many of them will come back and say, I never realized what a big deal this was. It never occurred to me that this could have so much influence on my health and on my sleep, not to mention specifically my breathing. In fact, a point of reference, which is very valuable information to motivate you, they actually did a study with Flonase where they took some sleep apnea patients and treated them. I believe it was a randomized controlled trial. And they treated one group with Flonase and the other group they didn't. Well, in the group with Flonase, their index of breathing events actually dropped. So that's how important it was. By just treating with a nasal steroid and improving the nasal patency with that alone, then they were able to actually have this reduction, not that it cured the sleep apnea, but that it made the sleep apnea somewhat better. And it was statistically significant finding. So these are the reasons why we would push this so diligently amongst our sleep apnea patients, because they have to use that breathing mask. And you can imagine if you use that breathing mask and you're congested, what do you think is going to happen 2 hours after you've fallen asleep? You're going to yank it off. And you're going to yank it off because you're either aware of it, you wake up, or you're not even going to be aware of it. Just you'll sleep right through it, yank it right off. So being aggressive there is very important. Now, another step, of course, would be go to an allergist, have evaluations, get allergy shots, and go through that whole routine. Another possibility is medications. There's many out there on the market. Again, I'm not saying they don't work. Some of them do. I'm not saying they're not a good treatment pathway for some people. I like this model so much better because it's more about you're working with your own personal hygiene. You're taking the ball and running with it, so to speak, and you're usually getting very good results. And I think the popping of the pill mentality is already highly problematic in this culture. And I think that if you have to use the pills, that's fine. But if you can attempt this approach, I think you will be more satisfied if it works for you. And of course, it can't work for every single person, but it's certainly worth a shot.